doing? A very good morning to you on this beautiful, beautiful, beautiful Wednesday. I hope you are well and safe and keeping okay. Today, just like last week, we want to talk about interesting, topical, something that we didn't get to cover it a lot last week. Yes, last week was supposed to talk about hypertension and cardiovascular disease. Mukaleta maswali mingi sana za hypertension, which is okay. It is your right to ask the questions and to get your answers. So today we want to focus on cardiovascular disease. When I posted that this is the topic today, watu wakasema sisi mambo ya roho na moyo. Of course, vile Manchester United imekuwa ikinifanyia, niulize daktari anitibu. Because we are heartbroken, we are suffering, but it's okay. So if you have any questions around cardiovascular disease, heart disease, we can say heart disease, right? Yes, heart disease, you can go ahead and ask them on 2242 or hashtag DayBreak. And even as we discuss and some questions come up in your mind, you can go ahead and ask those questions. We're going to be posting that up for you in a short while. But
this is Jeff Coenzyme Live. You went through a very difficult time.
Of course, ladies first.
Yes, good morning, everyone. My name is Dr. Elizabeth Waroy, a medical doctor at Mater Hospital.
All right.
Good morning, everyone. My name is Felix Okoth, clinical nutritionist at Mater, and also a pediatric nutritionist.
Okay, karibuni sana to both of you. So I guess we'll start with you, Dr. What are, I guess, some of the, I don't know if you want to call them common cardiovascular diseases or heart disease? Yes.
So when we say cardiovascular diseases, that's an umbrella term for so many diseases that are there. So one of the cardiovascular diseases is coronary artery disease. That's a disease where you have a disease of the blood vessels supplying the heart. Then we have cerebrovascular disease. That's a disease of the blood vessels supplying the brain. We have a peripheral arterial disease, a disease of the blood vessels supplying the lower limbs. We have DVT or deep vein thrombosis. That's a disease that causes clots in the brain. And we also have things like congenital heart diseases and rheumatic heart disease. So when we mention cardiovascular disease, we're mentioning all these diseases that affect the blood vessels that supply these vital organs in the body.
So then in that regard, is there something that people could be eating or taking in? And I know you people always fight alcohol. But it's okay. But is there something that people could be taking in that could put them at greater risk? Of heart disease?
Food is medicine, and we say that, right? So there are things that you can eat. That, we talked about high blood pressure last time, and what can really affect high blood pressure. So more or less the same, but there are others that can still lead to worsen the heart condition or cardiovascular diseases. So most people with cardiovascular diseases have higher chances of having blood clots.
Okay.
And doctor can tell you that they have higher chances of having blood clots. So when they have blood clots, normally they're given blood thinners. So when given blood thinners, what leads to blood clot is generally something called vitamin K. So people tend to use the medication, but forget the nutrition part that is important in helping cardiovascular disease. So when you are in a blood thinner, is to make your blood not to thicken much. And naturally, what makes the blood thicken is something called vitamin K that come from green leafy vegetables, the dark green leafy vegetables that we say are healthy. So you get people with heart condition, and let's say someone has blood clots, they will have the information that green leafy vegetable is the healthiest. But at that time, you need to be very cautious, because if you take more of them, then the medication will help in thinning blood, but the vitamin K is helping in thickening blood. So that affects something called INR levels, okay? So when vitamin K levels are high, INR levels can go low, but when the blood thinning is high, it can affect the INR level. So for such people, we'll tell them to take a bit less of the green leafy vegetables. So people with heart condition should really check on minimizing green leafy vegetables. And maybe they can take the African greens twice a week and more of the yellow ones, the broccolis, the cabbages and more, the carrots and all that. Then apart from that, we also talk of the fatty food, just as general as we talked last time.
Saturated fats.
The saturated fats. And so if I tell you check the good oils, it might be difficult. But the most thing, we talk of moderation. And if you check on our previous show, you can follow up and see how you should use oil generally. But there are also at this stage, when someone has cardiovascular disease, we really want to try help this person muscles function, because remember, at this time, muscles of the heart might weaken, or the muscles of the body might fail to function as required because of that faster blood flow. So you remember when a mother is pregnant, they're normally being given folic acid. So one of the function of folic acid during pregnancy is to help in formation of muscles for the baby. So it doesn't mean when you are an adult, folic acid won't help in formation of muscles. So folic acid is called vitamin B9. So it still comes from the green leafy vegetables. But even as a man or as someone who has heart condition, if it is worse, we can still prescribe for you folic acid. But it depends with your condition and the other underlying condition that you have, and the dosage will give you. But you can alternate the green leafy vegetables. Then apart from that, we have something called coenzyme 10. It's called CoQ10, okay? So coenzyme 10 is one of the components that the body have. I know it's a big jargon word, okay? So it's one of the nutrients that the body have, and naturally, we get it from chia seeds, flax seeds, and that's why people with blood pressure, when they take more flax seeds, chia seeds with water, it tend to really control their blood pressure because coenzyme 10 help in functioning of body muscles. Then apart from that, we also have amino acids. So amino acids are a building block of protein. Protein come from plant proteins such as beans, njai, the cereals, let's say. But we also have the animal. But people with heart conditions still has high blood pressure, we tell them to take more of the plant protein than animal protein. Despite animal protein having some nutrition benefit, but they have fat components. So if they take them in excessive, then what will happen, the cholesterol levels will increase and will cause the plague that doctor is saying that causes most of this cardiovascular disease. Right. So we have this amino acid or building block of protein that is called L-centrulin and L-arginine. So L-centrulin and L-arginine naturally come from the beans, the njai, and all that. But they can also be found as supplements. Right. So generally what they do is that we have a component in the body called the nitric oxide, okay? So the nitric oxide come from things like meat. So we say meat is bad, but I will say meat is still beneficial to the body. But the only danger of meat, red meat, is much of the uric acid that we always talk about, the waste of the protein in red meat being digested to form purine, then uric acid. That if you eat too much red meat, and we say not more than twice a week or once a week if you are having heart condition, but lean meat trimmed with fat, because red meat has a lot of B vitamins that also play general role in our cell function and general body function. Right. So, but it has something called nitric oxide. The other source of nitric oxide, we can get it in the cocoa product that we talked about. And that's why I said it's not good for people with heart condition or high blood pressure for long to dwell much on tea leaves and caffeinated drinks. So you can do cocoa because it has the nitrate that now this L-arginine amino acid and L-centrulin form to nitric oxide. So the function of nitric oxide to the body, and we have talked of the sources, they come also from things like spinach and all that. It acts as something called vasodilation. So vasodilation, it means that it tends to open the heart muscles or the arteries, and mostly that is what the medication you're being given does. They vasodilate the nerves, they open them in a way. So you can take yes, the vasodilate. Yes. People? Yes. So and we have so many things because there is that faster circulation. We really want to tend to prevent the inflammation of the arteries. So we have anti-inflammatory food, and that's why people talk of garlic. So we have garlic is a natural anti-inflammatory, antioxidant, because if the cells are oxidated, oxidation means we have bad oxygen molecules within our system that the body should get rid of, okay? So if the bad oxygen molecules are concentrated, then the inflammation can be more, okay? So they reduce that oxidation, and then they also strengthen the heart muscles so that when the heart is pumping extra harder, the muscles doesn't weak. So you can take like 2 bulbs of garlic, crush them in a glass of water is good because it will also prevent you from cancer. So that's okay. But if...
With nothing else? Or?
No, you can do honey if you're not diabetic, that is.
Okay.
If you're not diabetic. But there is also garlic capsules.
Right.
And so many more that we'll talk about as we continue the show.
All right. Yeah, so the other thing is most people, when they hear cardiovascular disease or heart disease, we hear words like heart attack. We hear words like cardiac arrest. So maybe you can... What happens, for example, when somebody is having a heart attack?
Okay. So when we say someone is having a heart attack or a cardiac arrest, the medical term of that is myocardial infarction. So infarction really is when there's tissue death or there's a certain part of the heart muscle that is not receiving sufficient blood. So cardiac arrest now occurs when you have the blood vessels. The heart has various blood vessels, the major ones that supply blood to it. So when these blood vessels are narrowed, and the narrowing comes from deposition of cholesterol or the fatty substance known as plaque. So when this plaque is deposited there, and then over time it can rupture and form a clot. So this clot, while it's there, it brings about narrowing of the blood vessels that supply the heart. So narrowing of the blood vessels will, with time, cause symptoms. Some of the symptoms that some people present with people who are on the... When you're on the onset of getting a heart attack, you'll have symptoms, yeah? And the most common symptom one has is chest pain or a crushing pain or discomfort in the central area of the chest, the sternum. This pain is usually on the left side, radiating to the left arm, the neck, and also the jaw. And this is what we normally call as angina medically. So when you're having angina, it means there's a portion of the heart muscle that is not receiving sufficient blood. So that is when there's narrowing. But now this narrowing can be completely excluded by this clot. So when you have a complete exclusion of a major vessel that is supplying the heart, then now that can result as a heart attack or a cardiac arrest, or now what you call myocardial infarction. So when you're having the angina or the chest pain and all that, what basically you're having is what we call medically as myocardial ischemia. Ischemia really is where you have a reduced blood supply to a certain portion of the heart muscle, because the heart has muscles. So when a certain portion of the heart is not getting the amount of blood it needs and the amount of oxygen it needs, so it will undergo now ischemia. Now that's what will present clinically as chest pain that radiates to the left arm and also the jaw. Some of the other symptoms one can present with are usually shortness of breath. This is now before the cardiac arrest. Someone will have shortness of breath, or when they're doing an activity, even at rest, they're breathless. Maybe even on lying down, they have what we call orthopnea, that is breathlessness on lying down. When you check them clinically, they may have distension of the neck veins. When you auscultate the heart, you'll hear an added sound, what we call an S3 gallop. Even in the lungs, there can be fluid buildup, what we call pulmonary edema. So when you auscultate the chest, what you'll hear are crackles or something called rills. To a certain extent, you may get wheezing. Also, when you, as you're examining the patient in the abdomen, you may find this buildup of fluid, what we call ascites. There can also be enlargement of the liver, what we call hepatomegaly. In the lower limbs, you may have bilateral enlargement, bilateral edema, that is swelling of both feet. Yeah, so those are some of the signs and symptoms that one can present with. But the main typical symptom that should give anyone a high index of suspicion is when you're having that central chest pain radiating to the left arm, neck, jaw, and the neck. Yeah. And
so so when you say crushing pain, you feel like what somebody's pressing on you?
Yeah, so it's described as squeezing or crushing on the central part of the chest, and now the typical thing is that it will radiate to the left arm, yeah, and the neck and the jaw.
And the neck. So is the neck this side, or like you feel as if
it's radiating to one side of the neck? Yeah, so it's the pain. You see, when you say radiation, it means the pain, there's where it's coming from, but then there's where it's also going. Or there's where it's being referred to. Yeah, so centrally you feel it's in the chest, so that's where it starts. But it also gets referred to now other areas.
There's a time I read an article, I don't know if it was true, about not really how you can stop or how you can sort of buy yourself time, things like cough or something like that. I don't know. Is there anything you can do, like when you like when you start feeling that, or you just need to just call and get help immediately?
I think once you have such a symptom, have a high index of suspicion that you could be having a myocardial infarction, especially if you're a person who has risk factors. As we mentioned last time, there are those risk factors that cause you to have heart disease, to have hypertension, which are more or less the same. We mentioned things like alcohol, smoking, if you're overweight, obesity, high cholesterol levels. So if you have certain risk factors and you get those symptoms, it's very important to have that high index of suspicion and get checked by a doctor. Yeah.
And what would that check entail? Like, if you, how do you check?
So once you start having these symptoms, you go to the doctor. So what the doctor usually does is you have to do a physical examination. And as you're doing the physical examination, you're taking a good history to try and find out what really is causing these symptoms, what is the risk factor that this patient is having. So yes, a very good history to point you towards the cause. And then now physical examination, as I was mentioning, you get to check all those things. It's a head-to-toe examination. So you check the face, they could be having puffiness. As I mentioned, the neck could be having distension of the veins. You auscultate the chest, the heart, all those things. So you do a physical examination. Then from there, then you'll do some tests. They're usually lab works, which you draw a blood sample, and you can also do imaging. So when you're doing laboratory examinations, there's specifically a full hemogram. Right. Full hemogram, you'll do it because you want to check for certain causes. Like now, anemia. Anemia is a huge cause of heart disease or heart failure. So with a full hemogram, you'll check the hemoglobin level. And then you can also check infections, because also there are certain infections that can cause heart failure. And then you can also do something called a urea electrolyte creatinine test or a renal function test, because kidney disease is also a very major cause of cardiovascular diseases or heart disease. So with that, you can be able to check whether that is what is causing the symptoms. You can do a urinalysis. With urinalysis, you'll be able to check things like proteinuria, that is protein in urine, which is not normal. When you're having proteinuria, it points you towards a disease known as nephrotic or nephritic syndrome, which is a part of kidney disease. Right. Also in a urinalysis, you can check for diabetes, because once you find glucose in urine, then that means this patient could be having diabetes. Another test you can do is a random blood sugar, which tells you the sugar level of this person at that moment. There's also something called a HbA1c, which gives an overall control, glycemic control over the last 3 months, to show how has your sugar control been in the last 3 months. Then there's one that is very specific to the heart, known as the cardiac triage or the cardiac markers. So these ones, there are certain levels, especially one called the troponin. These are cardiac enzymes. So if they're elevated, it points you towards a certain cause of this disease. Right. Yeah, so these are some of the tests that you do. And something else that can point you towards also diagnosing is the symptoms someone presents with. So sometimes the symptoms of heart disease are not very typical or are not very specific to the heart disease. So as I mentioned, you have to have a very high index of suspicion when someone has certain symptoms. So the symptoms as well can point you towards diagnosing what this person is having. As I mentioned, the chest pain, sometimes you'll have a cough that is nocturnal meaning at night. The lower limb swelling, as I mentioned, the swelling of the liver. Yeah, so the signs and symptoms one presents with also can guide you towards diagnosing. So basically, when you come to a doctor, it's a good history, a physical examination, the laboratory test, and now the imaging. Right. So imaging, you have things you call an ECG. You've heard of an ECG? Yes. Yeah. Yeah. That's a monitor. Oh, that's a monitor? Yeah. But the ile inatoa that one now. That yes, one, that's the easy. Oh, okay. Yeah, so that one gives electrical. Yeah. It gives electrical activity of the heart. Yeah, so you do an ECG, and it should be done, especially if this is someone who's presenting acutely or they have unstable symptoms. That's the first thing you should do. Within the first 10 minutes of being in a hospital, that's the first thing you should do. And then you can do an echocardiogram. That's like an ultrasound, but now of the heart. This will show you the structure of the heart. It will show whether there's any dilation, whether there's any problem with the valves. Those are the valves, you know the valves? Right. Yes. Yeah, and then so there's a chest X-ray as well. So those also will show you whether there's any enlargement of the heart or any other abnormality in the chest. Yeah, so those are the main things you do when you go to a hospital. Yes. Right. Yeah. And so I guess, and somebody asked me this question yesterday, but I'm being told there's some SMS as well. Let's remind people of the question first. The question is this: what questions do you have around? Okay, all right, that was a question, but it's okay. Here's the question first. What questions do you have around
heart disease. What questions do you have around heart disease? You want to know something particular, or you've had so far the conversation and you have some questions. SMS 22422 and the hashtag to use is DayBreak. Before we go to the SMSs that have already come in, I just want to ask, somebody asked me this question, and you mentioned some of them that people need to eat to make their heart happy, as it were. But so what about somebody who, what would you do, for example, just because we've talked about a heart attack, somebody who is now recovering, what are some of the things they're eating?
So for recovering, it much depends with the condition the person had.
Okay.
Because as Dr. has said, there are a variety of conditions. Then it also presents with the complication this person is presenting with. Because if, let's say, you have just a heart condition on its own, without diabetic, without kidney disease, then we'll pick it as that. So one thing is your energy intake is very important, because your vessels, your heart requires so much energy to function.
Right.
And that's why we always say, despite you require energy for your heart to function, you will not really need the excess ones. Right. Because they will still affect your cholesterol levels. And as Doc has said, cholesterol is one of the markers that we really monitor. So anything that will build up cholesterol, we really have to avoid it. Then the other thing, when you are recovering, it depends again. When you are leaving the hospital, or you're presenting with edema, or you didn't have edema, because Dr. has said we will also check for edema, accumulation of fluid. So if you had accumulation of fluid, then we'll really tend to control your fluid intake. Remember, people with pressure are told to take a lot of water. But now with heart condition, we have to be very cautious. How is the heart so far? Is the heart enlarged? So if you have cardiomegaly or enlarged heart, then we really try to control the fluid, because we also don't want fluid buildup in the heart. So this will give you, depending, just similarly as we give people with kidney problem. So we can give you, depending on your urine output, whereby we say 500 ml plus the total urine output in 24 hours, similar to kidney people, or we can tell you do not pass about 1,000 liters to 1,500 milliliters of total water in a day. But if you have now edema, then we might even restrict it further. So it depends with that. Then the other thing, we also tend to encourage you, take food rich in potassium.
Right.
Because potassium generally tend to control the sodium levels within your body and also control the fluid. Ndio mtu usiambiwe you have fluid in the heart, because the body is not able to control both the fluid inside the cells and outside the cells. Then apart from that, similarly, salty food, you get them off depending on the heart condition. You can get them off. Let's say someone has edema or enlarged heart, we can get sodium off. And as Doc has said, electrolyte tests, we also do that, right? So electrolyte tests, we check on the sodium and the potassium and all that. So, but if you are not worsened up, then we might control the salt, and we said 2.5 grams to 5 grams a day, below that. And then apart from that, we'll check now the fatty food, spicy food, stimulants, you stop smoking, and then exercise become a very important part. And exercise for people with heart condition is not as strenuous as a normal person, despite you are overweight or obese, because this can still affect the heart. So if you have to do treadmills, you have to do friendly exercises. We call them, this is a dance, how do we call them?
Aerobics.
The aerobics, but not strenuous,
right,
because they can still affect your heart rhythms and all that. So then, like I said, the management will depend on the condition and the complication. So things like omega-3 fatty acids, if you have cholesterol, we can give you that. We can control your calcium depending on your calcium test, because the doctor can tell you when you have heart condition, too much calcium can still add in your arteries. Is that right? So we really have to control that. But it also advise you, it's good to stay on the sun. So the sun gives you vitamin D. So vitamin D, people know that, but it doesn't. Vitamin D comes from food, not from the sun. So from food like spinach, eggs, and all that, but don't overdo eggs. But whatever is in food is called vitamin D2. It's in active form of vitamin D. So the UV rays has to, when you take food, the vitamin D2 is stored under your skin, okay? So the UV rays activate the D2 to something called D3. Now a ready form of vitamin D that the body is able to uptake. So it's good to stay on the sunlight, and better the one in the morning at 10 or in the evening, because if you stay in the one in the afternoon, it can also affect your skin cells and can lead to skin cancer again.
Yeah.
So vitamin D, because it will control the calcium levels. Because if the calcium levels are not controlled, it will affect you. So I would say check on your water, check on your exercise, check on your fatty food, food rich in potassium, food lower in salt, food lower in stimulants such as carbonated drinks and all that, and you said caffeine. And the other thing, there are supplements we can give you, but it depends on your condition and stage at where you are. And if you're not in the worst condition, then we tell you to take natural foods such as garlic, natural foods such as chia seeds. Even the moringa can help in controlling blood pressure because it has several amino acids and several components that are good for you.
All right, so umesikia mkae kwa jua.
Hata green tea, hibiscus tea, those Chinese teas.
Vile jua imekuwa ikituchoma hapa na kama unasikia jua inakuchoma sana, ujue jua inachoma kulingana na dhambi zako. Anyway, if you'd like to make the deal, let's take a look at the questions that people have been asking. Here, someone says, I gave birth in 2017 through CS, and since that time I was going to theater. I've been hypertensive to date. What can I do?
All right. So she was diagnosed with hypertension as she was going to theater, so she was still pregnant. So we mentioned last time that there's something we call preeclampsia. And worse, when you're having convulsions, it's called eclampsia. So preeclampsia is a hypertension-induced pregnancy. Basically, when you're having high blood pressure in pregnancy. Right. It could be superimposed where you had high blood pressure before, but now it's worsened in pregnancy, or it could start initially in pregnancy. Some of the risk factors of preeclampsia could be nulliparity, that is a first-time pregnancy, carrying a multiple gestation, that is a twin pregnancy, having a molar pregnancy, having renal disease, obesity, hypertension, even change of paternity can lead to preeclampsia. So what can she do right now? So if she has now the hypertension, the only thing she can do now is now to be on medication. Sometimes, fortunately for some women, after they deliver, they tend to the hypertension goes away. And even there are those who get gestational diabetes, and after delivery, they are able to go back to their normal glycemic control levels. So if it continues, if the diabetes continues, if the hypertension continues, as now for her, the main thing is just to be on medication. There are drugs that are specifically given to mothers who've given birth, postpartum mothers. So for now, it's just to be on follow-up with her gynecologist or now a physician who will now take her through the medications she needs to use, and now continuous monitoring of her BPs.
Yes, continuous. Aya, we've been asema, I am hypertensive since 2010. I'm currently on losartan H, I hope I pronounced that well, and antenolol, 50 mg. What are the effects of these drugs you've taken for long?
So I'll answer it in this way. Okay. So these drugs are helpful drugs. Okay. So, but any drug will have a side effect. So the good effect is that they will keep your pressure controlled. Your pressure will be optimum. It will be standard. So losartan is the different categories of drugs that you're given. So he's on 2 different categories. So meaning his pressure could be a bit high. That's why he's on 2 different types of drugs. So the good effect is that his pressure will always be controlled, or it will always be optimum. So now I think what you wanted to find out is the side effects of these drugs. Yeah. So losartan is a type of drug where it's called an ACE inhibitor. So ACE inhibitor, some of the side effects they have is prolonged cough. There are those who get bilateral lower limb swelling. There are those who can get electrolyte imbalances. And to a certain extent, it can lead to kidney damage. Yeah, and then atenolol is a beta blocker. So beta blockers, their main function is usually to lessen the workload in the heart. So they reduce the heart rate. So if you take atenolol and maybe your blood pressure is too low, it can cause deleterious effects. But if he's maintaining it at that optimum dosage that the doctor has given him, it's doing more benefit than harm.
Yes. Then maybe to add on something.
Yes.
And apart from that, it can also cause abdominal issues, right? And that's why most people on this hypertensive medication for long sometimes suffer bloating and hyperacidity. So I will say sometimes when you have had hypertensive medication for long, it's good to incorporate them with something called probiotic. So these are good bacteria for the stomach lining to prevent that indigestive nature of the stomach and really keep the stomach lining at at packed.
Right.
On its healthiest place, so that you don't have this effect.
Right.
Because if you start having hyperacidity, then you start also taking medication for that.
Yeah.
So it's good to prevent, because they don't pose any side effect to the body. And studies show that they also tend to lower cholesterol. Yes.
So I hope, yes, we have definitely answered that. Someone says this: I've been having a bit of pain around my heart, and my heart tends to either slow down or speed up. What could be the issue?
Yeah, so as I had mentioned earlier, when you're having those symptoms, anything related to chest pain that is specific as squeezing, radiating to the arm, the neck, and the jaw, and you have certain risk factors, you're diabetic, you're hypertensive, you're obese, you have high levels of cholesterol, then it's high time now you see your doctor. So such symptoms should not be taken lightly. It's always prudent and always advised to see your doctor. Yeah, so for him, I'd advise him to see a doctor.
Yeah, what will slow down what would cause that?
So when he says it's slowing down, is it the heart rate? So
I don't know, maybe, that's what I was like. Interesting, but yeah, definitely needs to go get checked. Do Amadada, because you didn't leave your name. Right, let's take a look at the next one. Thank you, Kititer. This one says, sometimes my heart beats very fast without even doing anything. What will be the cause, and how can I avoid it occurring?
So when the heartbeat is fast, that's something we call tachycardia. And usually there are causes of tachycardia. There are very many causes. One can be infection, when you're having an infection. When you're having even high blood pressure can cause tachycardia. When you're not well generally, also when you're having anxiety. So usually there's a cause. More often than not, there's usually a cause. So the best thing is also have an ECG done, because with tachycardia, you have things called arrhythmias. Arrhythmias is when you have irregular heart rates or irregular heart rhythms. So this is normally diagnosed with an ECG. So I'd advise this person at least to have an ECG done. So with that, we'll find, is there a cause to this tachycardia or to this high heart rate?
Right.
Is there an arrhythmia?
Right.
Yeah, so it's important to have it checked.
Yeah, go and get it checked. All right, here's another question that says, can heart disease be contributed to by psychological stress?
So as we had mentioned...
Because we've been told, people have said oh, you smile, you use more muscles, you're happier, and your heart is happier. Now, jam at kuna toxins. This is what is said. Are some of these things true?
So stress won't cause, but it's a risk factor.
Okay.
Yeah. So stress can cause high blood pressure. As I mentioned last time, stress, when you're stressed at that moment, you are activating the nervous system. When you activate the nervous system, you will produce certain hormones. These hormones will lead to vasoconstriction or contraction of the blood vessels. This will make your blood pressure to go up. So when your blood pressure goes up, you're having hypertension. So hypertension, if it keeps on going up and it's not controlled, it's not managed, it will definitely lead to heart disease. So it's a risk factor. Yeah. So
it's a risk factor to live. Stress now.
And when they have the depression, they go to counselors.
Yes.
So that is controlled.
Yes. Yeah, you need to talk to somebody. Usikuwa hapo peke yako. Na usisafa na wadosi angalia watu wao. Right, somebody says here, I was diagnosed with is it angina? Is that angina?
Yeah.
All right. You did mention that. Angina heart problem. Can I have open heart operation to correct the gains that collapsed? He is a 15-year-old man.
So, as I had mentioned earlier, angina. Angina is now when you're having a certain portion of the heart not receiving adequate blood supply.
Right.
Yeah, so that is, you're having myocardial ischemia. So when you're having myocardial ischemia, it has not progressed to infarction. Infarction is where you're having tissue death or tissue necrosis, which is the medical term. So with angina, really you just manage the symptoms and you find out what really is causing this angina and treat that. So with angina, really you don't need a heart surgery. You just need to manage the symptoms. But now when you go all the way to myocardial infarction, to cardiac arrest and all that, now that's when other bigger, that's when I maybe may think of doing surgeries.
Right.
And so for him, not really. Yeah.
All right, so yeah, tafadhali. Yeah, hoa. All right, let's take a look at the next question here. Can you reverse hypertension and PAF by maintaining healthy BMI levels as well as exercising regularly. You talked about that.
Yes, but I think Dr. still can say something.
Okay.
Because to me, like I said, you can reverse elevated BPs, but reversing hypertension, you can only manage it, in my own opinion. You can manage it until the pressures are very normal. At that time, I will say you are as normal as anyone, but it doesn't mean you can reverse, because when you stop doing what is right, the blood pressure will still elevate. But if you do what is right, it will continue staying manageable. But Dr. can still add on that.
Yeah, so for you to be diagnosed with hypertension, you must have been monitored for a certain period of time, usually 3 months, and you're doing daily readings, monitoring. The doctor is assessing these readings to see whether there's a person who needs to be on antihypertensives. Right. So by this time, when the doctor says your pressure is a bit high and there's need for monitoring, maybe you're pre-hypertensive. And at this point, there's a very good window for you to take on the lifestyle management things. You try and reduce your weight, you try and do dietary management. If you're a smoker, you stop smoking. If there's alcohol use, you reduce alcohol use. You try and lower down the lipid or the cholesterol levels. So at this point, this is a very good window for the blood pressure to come down. But now once it sets in as hypertension, usually you now have to start the medication. And as much as you also continue with the lifestyle management, you have to use it together with the pharmacological medication. Yeah, so what usually happens is if your control is good with the lifestyle management, you will reduce the drug. But this should be done with a doctor, because you find sometimes patients usually just stop the medication by themselves or in their own discretion. So what happens is the doctor will reduce the medication to a very small dose that will maintain your pressure at that level. Yes.
All right, so physical exercise is also good though. What, 30 minutes a day?
30 to what? Actually, for those people with cardiovascular disease, I always say limit to 30 minutes. We don't want too much of it. So 30 minutes, 20 minutes, 30 minutes is okay, so that you also tend to help your body, help in blood circulation, burn extra fat, and control your weight generally. So that's 20 to 30 minutes, okay.
All right, how does lymphedema affect the heart, and can lymphedema be cured?
Yeah, so lymphedema is where you have bilateral swelling of the lower limbs, usually because of irregularities of the valves or the veins in the lower limbs. So now the symptom you present with is the lower limbs are swollen, what we call edema, and it's beating. So when you're having edema or swelling of the lower limbs, there's some form. Basically, there are 3 organs that you check when you're having swelling of the feet. It could be the kidneys, it could be the liver, it could be the heart. So basically, when you're having swelling of the lower limbs, you have to check those 3 organs, because those are the main 3 organs that can cause swelling. Can it be cured? Yes. Usually, I'd advise this. Lymphedema is more of surgical, so I'd advise the patient to see maybe a surgeon and check the valves, because they could be having valvular insufficiency or some problem with the vessels. So the surgeon can take care of that. And yes, it can lead to heart disease because it causes fluid buildup. Fluid buildup will lead to congestion, it will lead to pulmonary edema and all those things. So yes, it can cause or can be a risk factor to heart disease. Or heart disease can cause the swelling.
Can cause the swelling. All right. So okay. Cool. All right, let's take a look at another question here. Learning a lot. What is the difference between a heart attack and a panic attack? Yes.
So those are 2 different diseases. A heart attack is basically in the heart. So it involves the blood vessels that I had mentioned earlier, narrowing of the vessels to complete blockage of the heart vessel. So you get the heart attack. Panic attack, usually it's a mental condition. Usually happens when maybe you're in an area you're not comfortable with, or there's a certain situation that has happened that is you're not very comfortable with, or you're faced with a certain fear that you're not able to cope with. So panic attack is more of mental. Heart attack is a medical. Okay, it's more of the heart. It involves the heart and the structure of the heart and the blood vessels and all that. Yes, so they're different.
All right.
And also the symptoms. In a panic attack, you'll have things like anxiety. You'll have diaphoresis, you'll have sweating, you'll have tachycardia, that is the heart rate is high, you'll have tachypnea, the breathing is high. In a heart attack, mainly the symptom is that chest pain, and then sometimes now loss of consciousness. and lack of breathing. So even the presentation is totally different. Yeah.
Even you're right, the presentation as well. And for any of those, you need to take them seriously and go get help. Where you just say to you, panic near injury, so you won't go get help. Please, for both of them, go and get some help if and when you can. Right, does cardiovascular disease have a close relationship with erectile dysfunction?
Yes.
It does?
It does.
How? Oh my.
I will say,
wow.
in my opinion, and medically, like I can say it.
Right.
When you have cardiovascular disease or even long-time high blood pressure, this, when the heart beats so fast, or the rhythms of the heart are affected, or the pressure is so high, it tends to lead to inflammation of these nerves, of these arteries and everything. So the penis has something called penile arteries. So when they're inflamed or irritated, then it interferes with the blood flow down there. So when you see at the penis, there is how do you call it, a karungu, and it has some pores. So for a full erection, the blood has to fill that area. So if there is poor blood circulation within that area, then you'll automatically have erectile dysfunction. So, and at that point, the doctor might prescribe some medication. So I won't really advise people, when you have erectile dysfunction and you have either diabetes, you have kidney disease, or you have hypertension, or any cardiovascular disease, you go to these
the pills.
The pills,
Yes.
The Viagras and all that.
Yes.
You can get an attack and we lose you. You die one man standing. So we lose you. We can lose you. So in my opinion, yes, there is a relationship, but Dr. can expound more on that.
Yes.
Yeah, as he mentioned, there's a very strong correlation. Erectile dysfunction can lead to cardiovascular and vice versa. And usually, as he was saying, both of them involve the blood vessels. So for you to be able to have an erection and sustain it, it's because you're being able to vasodilate the blood vessels that supply the penis. So if there's an issue with the blood vessel, maybe from the heart, and you see the heart is a vital organ which pumps blood to all the organs of the body.
Right.
So if you're having a problem with pumping enough blood to the organs, then definitely there are certain organs that are going to fail, or they're going to not function as they should. Yes, so it's about the blood vessels. Yeah, so there's a
so that's why I know, without passing judgment, like you said, we have had so many reported cases where people have taken this enhancement medication and they get a heart attack. Could that probably be the reason why the vessels and stuff like that? Because I guess it increases the heartbeat, I don't know, something like that.
So the medications that are usually used, as he mentioned, one of them, so those ones are they're also used to treat pulmonary hypertension. That is when you have hypertension in the lungs. So they help in vasodilation. So when you're having, when you take such drugs, and maybe you are a person who's hypertensive or you have a cardiac disease, you're also causing vasodilation of these other vessels in the heart. So usually what happens, you can get what we call, let me use a layman term, burst. The arteries can burst, and then you can get something called cardiac tamponade. And then this, if there's fluid buildup around the membranes of the heart, what we call pericardial effusion. So if there's continuous buildup of this fluid around the heart, it can lead to a cardiac arrest.
Right.
Yeah, so basically it's the fact that it's causing vasodilation.
All right, yeah. Well, like I said, Leo, but someone says here, when I sleep on my left side, I feel some discomfort and shortness of breath. What could this be?
So when he sleeps on his left side, so shortness of breath is a huge symptom, or it's a main symptom of heart disease. So anyone who, if you're lying down or lying flat and you get shortness of breath, if you wake up at night gasping for air, what we call paroxysmal nocturnal dyspnea, gasping, so that's waking up at night gasping for air, that's also a symptom of heart disease. So when you get such symptoms when lying down or waking up at air, gasping for waking up at night gasping for air, it means then there's something that is happening, so you need to see a doctor. So I'd advise this person just see a doctor, because sometimes you just have to go to the hospital to do some tests, yeah, so that you're able to find out really what is happening.
To see exactly what it is. To see exactly what it is. All right, well, look at that. It's time to imefika, and You know, most of the times people feel a lot of these things, but I think one of the things that is either, I don't know, because of access to healthcare or just basically culture, people like to tough it out. So, hii itaisha tu, nikunywa maji tu nilale, hii itaisha tu, you know. So, but you know, if you have some questions that we've not been able to answer, they're going to tell you right now where you can find them, and then you can ask them or make appointments to visit them. So what's up with you?
All right, so I'm usually based at Mata, Karen branch. It's located at the Well, and from Friday, Saturday, and Sunday, we're having a medical camp, which is free.
Oh.
We'll be doing height checks, weight checks, free sugar checks, calculation of BMI. There'll also be a nutritional personnel who will be advising people on the right diet and how to manage their BMI. So yes, everyone is invited.
Where is the venue?
Where's it going to be?
The venue is at the Well, Karen Mata branch, which is along Langata Karen Road. Mm-hmm. Yes, so the Well is the mall. That's where the hospital is located. Mm-hmm. Yes.
Nani free. So again, just like I started saying, watu wanaogopanga because nitalipa access host, NHF yangu iko sawa, sina insurance, bei imepanda. This one is free, so go get checked. Felix, where can they find you?
Routine checkup is important.
Yes. How? So when you say routine checkup, it's once a year?
I would say once a year is okay.
That is if you've just been okay.
If you've been okay. So once a year is okay.
Yes.
And why I say this, we'll tend to pick up these things early and prevent them. And we have something called well months persons package and well women's. So we do the kidney profile, the lipid profile, a sugar profile, your weight, BMI, and the nutrition consultation is also there free, which if you find me where you will go, I'll do it to you. Free of charge, within that package which NHIF pay for. So you can find me at Mata, and as I say, I rotate a lot. So Mata Buruburu on Tuesday, Wednesday, and Thursday. You can find me on Shujamal on Monday and Friday, but we are tending to start a nutrition clinic at Mata South B, which will be every Friday. But in case of anything, you can just get in touch with me through Mata website number, and Willis has my number.
Yeah, I have my numbers.
Yeah.
I can hook you up.
So get through me, Mata website, or come to South B, then we'll get to help you.
Yeah.
Yes.
All right. Well, asanteni sana, and thank you so much for your questions. I'm always so overwhelmed, and sometimes I scare about it, but again, that's why they tell you where they are, so you can go ahead and get in touch with them. And like Dr. Arroyo said, please, it is free. Kama ni kitu haulipi, enda tu angaliwe BMI usaidiwe, enda uangaliwe height usaidiwe, enda uangaliwe hizi vitu tu, enda tu.
I'll be there on Saturday.
And yes, and nutrition as well. So this Saturday, 26th, the Well, 25th, 26th,
27th.
and 27th. 3 days umepewa ya free. So ukichoma na jua, ujue uko sawa, tafadhali. Yeah. So go and get checked. That's what it's all about. Thank you so much for your time. At least niko sawa. Nimejua nikiwa na umeita nini ile ya kupiga haraka?
Tachycardia.
Tachycardia. Nikiwatch game ya Man U. Hiyo inakujanga sana.
Kunywa maji.
Tachycardia, but that's just on a light note. We'll see you guys here again next week. We appreciate. Thank you so much for watching, and peace and love. Successful people look like you. And the great Tachycardia, Manchester United.